everyone. Welcome to KHA Homeopathy Study Group Pro Bono Webinar. Good morning, good afternoon, and good evening. So nice to see many of you from different countries and different time zones. Before we start our webinar, always thank Universe for giving us this great opportunity. And Dr. Sweta Singh, our KHA Chief Administrator, will start the session.
Hello everyone, myself Dr. Shweta Singh, KHA Chief Administrator. Welcome our respected speakers, Chairman and CEO Kavita Ma'am, KHA volunteers and all the attendees to KHA webinar. I would like to take the opportunity to introduce KHA Homeopathy Study Group to all of you. KHA Homeopathy Study Group Pro Bono was organized and founded by homeopath and humanitarian Kavita Kukunur, President and CEO of Kavita Holistic Approach, KHA. This study group is intended to be an offering from Kavita to the homeopaths around the globe, sharing goodwill and solid clinical work within the classical model are foundational principles for KHA. KHA's mission and vision are very unique to inspire young homeopaths, mentor, provide excellency for educational purposes using holistic approaches via webinars which are based on principles of classical homeopathy and provide professional continuing educational homeopathy credits for practitioners. We provide merit certificates for spreading the light of homeopathy around the globe. Dr. Kavita is a member of Kevin Friendly Foundation, a non-profit organization that helps to serve poor people in greater needs in India. She is nationally board certified by Council for Homeopathic Certification, CHC, and ECHINA CPD provider and serves as the associate editor for the Homeopathic Heritage. She is the recipient of Martha Ullman Community Service Award by National Center for Homeopathy and Best Entrepreneur Award from Dr. N. Linga Raju, Principal of JSPS Homeopathic Medical College, Hyderabad, India. TANA, Telugu Association of North America, a prestigious organization, honored and awarded her for selfless homeopathic and humanitarian services at Ladies Night Out on October 2022, Michigan. Also, Dr. Kavita received the prestigious Legendary Homeopath Award with joint hands of Honorable Health Minister Dr. Dhansin Rawat, Senior MLA Mr. Harbhajan Singh Chima, ex-Director Homeopathy, Government of Uttarakhand and Chairman of HomeoCure and Research Institute during National Homeopathic Seminar, Homeopathy, the Future Medicine at Kashipur on 21st August 2022. Dr. Deepak Sharma, KHA Executive, Dr. Rajneesh Kumar Sharma, KHA Advisor, and myself, KHA team were also recognized and presented with Legendary Homeopath Award at the ceremony. We are proud to announce that Dr. Kavita was honored as the Woman of the Year 2023 from prestigious organization NATA, North American Telugu Association, USA. Dr. Kavita was also honored by renowned DTA, Detroit Telugu Association Executive Committee on Mother's Day at Michigan, USA with DTA Community Service Award 2023. We are extremely happy and proud that we celebrated 12 years of her book, Beyond the Limits, A Challenge to Prove Oneself, and her second book, A Dose of Spirituality with Kavita, has also completed its 2 years and we had celebrated its second anniversary last month. The ebook was launched last year in the presence of Honorable Guest of Speakers, American Institute of Homeopathy President Dr. Alex Becker and Council for Homeopathy CHC President Dr. Sheetal Tiwari at our KHA webinar. At KHA's second annual celebration, our Honorable Guest of Speaker Dr. Jawahar Shah, Chairman of Enlightenment Education, launched its audio version and hard copy. We have donated over $1,500 to 10 to 15 charities, which we have also listed on the website. Dr. Kavita donated the proceedings of the book through KHA Homeopathy Study Group platform to various charitable organizations and homeopathic associations. To name a few are Kevin Friendly Foundation, CHC, DHMA, JSPS College, VT Seva, NCH, etc. Interested one can reach us for details at khastudygroup@gmail.com. As of now, we have nearly 400 recordings on professional webinars related to homeopathy, health-related topics, and inspirational talks available on our channel, Kavita Kukunur. This webinar is moderated by Ka family, myself, and Dr. Shravana Pitla, Ka volunteer. It's being recorded as we speak. We will take the questions at the end of the webinar, and we will also post short form in Zoom webinar chat at the end of the webinar. So please fill the form to receive your participation certificate. Kindly mute yourself and turn your video off for better connections. Now, before starting the scientific session, I would like to invite Dr. Shravana to read Code of Ethics. Over to you, Dr. Shravana.
Hello everyone, this is Dr. Shravana. I'm glad to be a co-volunteer and now I'm going to read about the study group pro bono, which are our ethics. So to be a car speaker, it needs at least 1 to 2 months to be active volunteering. Only car speakers' themes are promoted in newsletters and webinars. Car group provides volunteering for 2 to 12 months. It respects and inspires volunteers to grow. Active volunteers will be promoted throughout website, social media, and added to our WhatsApp group. Articles of volunteers will be posted on CAR website and newsletter and will be sent for publication at journals. Volunteers and speakers are eligible for prestigious CAR annual awards. Volunteers are eligible for CAR inspirational talks. Volunteers are eligible for case discussions. CAR promotes homeopathic organizations as well as their mega events. CAR promotes great work of speakers through their book reviews. Honorable guests may propose their future courses or events after the webinar. CAR maintains a healthy and happy environment, so keeps only like-minded folks. CAR requests everyone to maintain the confidentiality of the group. Thank you, everyone. Over to Dr. Shweta.
Thank you, Dr. Shravana. Now it's time to introduce our speaker. So let me introduce our honorable speakers to you all. And today we have with us Dr. Rajneesh Kumar Sharma and Dr. Sakshi Gupta. First, we will go with Dr. Sakshi Gupta, who has been practicing homeopathy and psychology in Delhi since 2013 at her private setup, Complete Homeo Care, and working with Orbit Clinics as an associate consultant since 2020. She has been holding integral positions in Executive Committee of Delhi Homeopathic Medical Association. She has authored various articles published in Indian and international websites as well as journals. Also, she works as a co-editor for an Indian homeopathic newsletter, Exploring Homeopathy, and managing editor for the Hanimanian Homeopathic Sandesh. Apart from these, she has been invited to deliver live lectures for fellow homeopaths and general masses by different organizations at different platforms. Looking forward to great learning. Her topic will be psychology, physiology and psychology behind sleep issues. Welcome, Dr. Sakshi, to CAR platform. Dr. Sakshi, am I audible? Can you hear me, Dr. Sakshi?
Hello.
Welcome, Dr. Sakshi, to CAR platform. Am I audible to you?
Hello.
Hello.
Ma'am, can you hear me?
Yes.
Okay.
Okay. So
There was
welcome
some.
once again to CAR platform. So you can
Thank you,
proceed
ma'am,
with
for
your session.
inviting me.
Thank you.
Thank you so much. Ma'am, will the PPT will be shared from your side, or I'll be sharing that?
You can share. Yeah.
Just a sec. Is it visible, ma'am?
Yes, it is.
First of all, I'd like to thank you, ma'am, for inviting me, and Dr. Kavita, of course. She gave so much inspiration before the session. I'm really honored to be here.
Thank you. Our pleasure.
Thank you, ma'am. So, to begin with, my topic is physiology and psychology behind the sleep issues. So, like we'll be beginning with first of all the definition of sleep, what basically sleep is. So, as we all know, but sleep is a normal, it's a reversible, recurrent state of awareness and responsiveness to the environmental stimuli, which is accompanied by complex but predictable physiological changes, which is experienced variably by all animal species.
Sorry
Uh,
to
in
interrupt,
my
Dr.
opinion,
Sakshi. Can you please zoom your slides?
I was trying, ma'am, but I guess there's some issue here. I shared with Dr. Sravana. Can she share?
Let me check.
Yeah, 1 second, let me try.
Yeah, thank you, ma'am.
Yeah, is it visible now?
Yes, ma'am, I can see that.
Okay. Yeah, go ahead, Dr. Sakshi.
Yes, thank you, ma'am. In my view, like I have been attending various webinars, like they are conducted here in India by various associations and internationally too. But regarding a session regarding sleep or sleep issues, I have like there not have been many. It might seem as an unusual topic, but I believe that sleep is something which is occupying most part of our lives, like during the whole life of 1/3 of our lives we spend sleeping. So there is no other voluntary action which is this predominant, making it really important to be well spent. So like we need to spend it really well throughout our lives, because it occupies a major part of our life. From the 24 hours of a day, we all know that average sleep duration needs to be 7 to 8 hours. So it's actually very important. So, ma'am, next slide. So basically, how do we get to sleep? So there are some suggested sleep mechanisms. There are a few theories behind that. Two internal mechanisms are there. One is homeostatic sleep drive, and other is circadian rhythm. So basically, homeostatic sleep drive, what does it do is it basically it reminds the body to sleep after a certain time, and it helps regulate the sleep intensity. The sleep drive gets stronger every hour we are awake. Every hour we are not sleeping, the intensity, the requirement of the body to sleep gets stronger and stronger. And it, like after the sleep deprivation, and the circadian rhythm, which is basically the biological clock, it directs a wide variety of functions, from daily fluctuations in wakefulness to body temperature, metabolism, and the release of hormones. So the process of sleep, it starts, ma'am, next slide. So here from the diagram, we can see that the process of sleep arousal starts when the exposure to light is blocked or it's minimized. The signal from the ganglion cells inside the retina is blocked, which is sent to the suprachiasmatic nucleus, which is the center of the circadian rhythm in the brain, is blocked. The signal from the ganglion cells to the suprachiasmatic nucleus, it's blocked. Then the sleep arousal starts. And in turn, that signal reaches the pineal gland via the spinal cord. So when this pathway is blocked, the sleep arousal process starts. When this pathway is obstructed, hormone, you can see in the diagram, melatonin, it's released, the hormone that makes us feel drowsy. So the amount of melatonin in our bodies, it starts increasing in the evening and peaks in the middle of the night, which allows the body, or lets the body know that it's time to sleep. And then it then decreases by the morning, which allows us to wake up fresh. It tells the body, okay, the duration of sleep is over, now one needs to wake up. So during the day, such signals prevent the pineal gland from producing the melatonin, because we have the exposure to light all the day, all throughout the day. So basically, the exposure to light prevents the melatonin release, and when that stimulation is obstructed, melatonin is released, and we are bound to get a good sleep. So that is why I guess now we know that why do people, we need to, human beings specifically, need to sleep with closed eyes, so that the obstruction to, ma'am, previous slide only, obstruction to light is blocked. And that's why the reduced screen time, it also helps to uh, hinder that stimulus to go to our retina and then reaches the pineal gland. And hence also here I would like to mention the night shift workers, they often have trouble falling asleep when they go to bed, because their routine is not fixed, or their circadian rhythm, the biological clock, which is normally how it is, how a default it is for the human body, it doesn't work like that. So the sleep wake cycle is disrupted, and similarly in the cases of jet lag, circadian rhythms becomes out of sync with the time of day when people fly to a different time zone, which leads to a mismatch in the internal clock, the circadian rhythm basically, and the actual clock of that particular time zone. So this is how we get to sleep, the basically the physiology of uh, sleeping. Ma'am, next slide. So why does one require to sleep? Basically, the 1/3 of our lives, as I said, it's not an unproductive part of the day, or one shouldn't think that okay, the time we slept was wasted. This 1/3 part of the day decides that how full, how energetic, how successful the other 2/3 of the day would be. The how good the sleep, the quality of sleep decides the other 2/3 of the day. As there are certain theories, there is not a specific mechanism behind that why do we sleep, but there are certain theories which try to explain that why does human body require to sleep. So first one is repair and restoration theory. So what does this theory say is sleeping is essential for revitalizing and restoring the physiological processes that keep the body and mind healthy and properly function. So during sleep, the body also increases its cellular division, muscle repair, and protein synthesis, and there are certain hormones which release during sleep. So this is basically what the repair and restoration theory says, that this is why our body requires to have a good night's sleep. The next is evolutionary theory, which suggests that period of activity and inactivity evolved as a means of conservative energy, because according to this theory all species have adapted to sleep during like different periods of time, but all animal species they tend to sleep. So this is basically like the part of evolution. Next is this brain plasticity theory. This theory says that sleep, basically it allows the neurons to reorganize. When we sleep, our brain, the lymphatic system, it clears out the waste from the central nervous system. It removes all the toxic byproducts from the brain, which which build up throughout the day. Like we are using our brains throughout the day, so the waste material which is collected, the lymphatic system clears it off. It happens during the sleeping hours, according to this theory. So this allows the brain basically to work better during the, like, in the next day to come. And the next theory is this cognitive function theory. What does this theory say? According to this theory, like we all know and we all experience that sleep affects various aspects of cognition. Like we could say it's learning, memory, problem solving skills, creativity, decision making, focus on something, concentrating over something. So all these aspects of cognition, sleep affects all of them. So basically what happens is sleep converts the short term memories into long term memories, the things which we have acquired throughout the day, and then we sleep, it gets converted into long term memories as well. And also during sleep, what happens is erasing or forgetting, which is unneeded information that might otherwise clutter the nervous system. We have a limited memory, we have a limited brain capacity for storing things. So whichever is required, it is turned into long term memory. And in case there is something unneeded or certain things which are required to be forgotten, so that clutter is also removed during sleep. And similarly, that way only, if one is sleep deprived, it has a serious impact on their ability to recall certain things, because that short term memory might not have converted into long term memory because of deprived sleep. Okay, so the next is emotional well-being theory. What does this theory say? That during sleep, what happens is brain activity increases in areas that regulate emotions, and like amygdala, striatum, hippocampus, all these prefrontal cortex, all these the parts of brain, what they do is support the healthy brain function and the stability of the emotions we feel. So this is one of the theories which suggest us why do one needs to sleep. Next is weight maintenance theory. Okay, so according to this theory, what happens is there is a hormone called ghrelin which increases the appetite, and there is one hormone called leptin which increases the feeling of being full. Okay, we have eaten enough. So what happens is ghrelin is decreased during the sleeping hours. When we are sleeping, the ghrelin decreases because we are obviously we are using less of the energy. And lack of sleep, on the other hand, what will it do? Ghrelin, the hormone, it will increase, and the leptin would be suppressed, which makes one have more hunger, and they'll be feeling more hungry and eating a lot, and resulting in obesity. On the similar grounds, the next is insulin function theory. According to this theory, sleep helps rejuvenate and keeps the cell healthy, so that they can easily take up the glucose. The function of insulin is to help the cells take up the glucose circulating. So this is how the good sleep works. The brain uses less glucose during sleep, which helps the body regulate the overall body glucose. So if the cells are healthy, they are functioning, they can take up the glucose easily. The next theory is immune system theory, which says that according to researchers, sleep helps generate antibodies and immune cells known as cytokines. That is why sleep is very important. Like if one is ill, if one is stressed, we need to boost our immunity. That's why we suggest our patients to have a good sleep, to take complete rest, so that those cytokines are released in our body and the immunity gets boosted up. So these are certain theories which have been suggested by researchers and certain studies, which helps us to understand that why do one needs to sleep. Okay, yes ma'am, next slide. Okay, so this image basically it shows that according to the age, how much of average sleep does one require. So if we say that during the infancy stage, the child needs more of sleep hours, and as we grow older, it basically settles down to 7 to 8 hours or 9 hours maximum. This is how much one needs to sleep during the 24 hours. Okay, so like if we have slept for this time, how do we know that we are sleeping well or not? If we have if we have spent 6 to 7 hours in bed, how do we know that we are this was the good quality sleep that we have got during the night? So there are certain things which we can use as a checklist, that okay, we had a good night's sleep, or the quality of sleep was much good. So the first thing is falling and staying asleep. If it takes around 30 minutes or less to fall asleep, if the patient goes to bed and he or she is able to sleep within 30 minutes, then we can say, okay, the patient is in good territory, means the quality of his or her sleep is fine. But if it is longer than this, then we need to consider it. Similarly, like there are frequent or prolonged interruptions of sleep signal, like if someone finds themselves awake in the middle of night for more than 20 minutes, despite they keep trying to get to get back to sleep, that might signal insomnia, or there can be other sleep disorders. Some disruption, these sort of disruptions, or a person wishes to visit the loo, or they're turning over in the bed, it's completely normal. But if these episodes are quite frequent, then again it's a trouble, they need to be checked upon. So the second thing we can check is staying awake. If the patient during the daytime, he or she finds it difficult to keep himself or herself awake, when they don't want to go to sleep, but they drift off throughout the day, that probably means that the patient is not having a good night's sleep. That's why they keep feeling drowsy during the whole day. And again, the third checklist can be through dreams. There are certain dreaming patterns that hint towards sleep quality, but they are quite tricky. There's a different branch, dream psychology and all that, which helps us to interpret those dreams. But if we talk in a broader sense, if the patient is having good dreams, it can be regarded as a sign of healthy sleep, you can say. However, most people, they do not remember most of their dreams. And but if the patient is complaining of nightmares or certain uncomfortable dreams, then we can say, okay, there might be some sleep issue, or they are having lack of sleep, that's why they are complaining of such dreams. Okay, one can make out through the mind symptoms and their mood. Like if the patient, the thoughts keep shifting track throughout the day. One time they're there, and one time they're thinking about something else. They have difficulty concentrating about certain things, or they cannot they cannot sit up complete, like uh, sit for few hours over a prolonged task, and they have certain mood fluctuations. Then again, this can be one of the symptoms that the patient is not having a good quality sleep. And they can even have like the hormones we talked about, ghrelin and leptin. If they are also disordered because of this sleep issues, then the patient will be having increased appetite, and eventually they'll have a weight gain. Increased appetite and weight gain, of course, they can be because of many other things, but just in case, we need to be look at the patient holistically, so we can keep this point in our minds that okay, this can be one of the reasons. And apart from that, if the patient is having certain nocturnal activities, like of course the patient might not be knowing that the attendants or the bed partner would be telling the doctor that okay, the patient might be talking while sleeping, or they are walking while sleeping. So these things, they are not, the patient might not remember these, but this is not the sign of a good sleep. This is not the sign of a good quality sleep, that okay, if the patient is talking or walking during the sleep or doing other activities, this is absolutely not normal, and this is not a sign of good quality sleep. So we need to check this list during our case taking. So there are certain things that make it difficult to fall the patient fall asleep. So if they are not having a good quality sleep, the next step would be to find out that what is the reason why the patient is not able to have a good sleep. So there can be a many things. So here, as we can see on the screen, first is stress and anxiety. What happens is, if the patient is under certain stress, they have multiple thoughts, they cannot calm their mind down or their body down. All these can lead to uh, reduced quality of sleep. And the other thing can be the in the room where the patient is sleeping, it might be abnormally hot or cold temperature. pertaining to the individuality of that particular person. Because what happens is that during sleep, we like during certain parts of the sleep, the body lose the ability to regulate the body temperature. So if that particular area is abnormally hot or abnormally cold, then of course it will disrupt the sleep of the patient. And again, if the patient is having excessive caffeine intake, caffeine is included in coffee, dark tea, soda, and all those things. So why does caffeine interferes in the sleep schedule? Because caffeine has a chemical, it is a chemical structure which is similar to that of a pigment adenosine, which is similar to melatonin, and which makes that caffeine to bind to the adenosine receptors. Although caffeine, it does not activate those receptors, it just binds to those receptors, making less adenosine to bind to those receptors, and those receptors though bound, but they are not activated. Hence the patient, the melatonin is not released, and hence the patient is not able to sleep well. Similarly, the nicotine, it is a stimulant which speeds up heart rate, and it speeds up the thinking of the patient. What happens is, heavy smokers, they often sleep very lightly. We might be having like all the doctors here, they might have at some point of their time, they might have encountered heavy smokers who might be complaining that okay, they are not able to have a good sleep. So, and like after that nicotine withdrawal also, they, if once they sleep, the nicotine withdrawal makes them awake like every 3 to 4 hours. So again, nicotine, like before bed, certain people have that habit of smoking before going to bed. So that also leads to uh, difficulty in falling asleep. And alcohol also, it initially suppresses the nervous system, which helps some people fall asleep, but the effect again, it wears off in a few hours, and then people again, they fall like they wake up from the sleep. And there are certain sleep disorders, like apart from these things, there can be certain sleep disorders which make the patient, it makes the difficult for the patient to get a good sleep. So what can be like, we'll be talking about certain common sleeping disorders only. The first one is acute insomnia. Acute insomnia, we usually don't need to treat it with medicines, because it can be because certain uh, indispositions can be there, which makes the patient making it difficult for him or her to fall asleep. And how do we judge that okay, this is the condition of acute insomnia? That the patient will be finding it difficult to fall or stay asleep for 3 nights or more in a week for at least 2 consecutive weeks, but that duration should be less than 3 months. Only then it would be considered as acute insomnia. But if it gets prolonged, it will eventually convert into chronic insomnia. And chronic insomnia would be again 3 or more bad nights of sleep in a week that goes on for 3 months or more. Acute insomnia, it has 3 or more bad nights in a week for consecutive 2 weeks, but less than 3 months. And chronic insomnia will be prolonged to 3 months or more than that, with 3 or more nights in a week. Then we have sleep apnea. It is basically a respiratory disorder, but it is experienced during sleep, which the patient might not be aware of. What happens is that the breathing stops frequently through the night, and the patient feels unrested, even like he or she feels that I was sleeping the whole night, but still he or she feels unrefreshed in the morning. And the partner might complain of the loud snoring as well. So it might be a symptom of sleep apnea. What are the common causes behind it? Like the common causes behind sleep apnea might be obesity, because in obesity, what happens is there are soft tissues which get relaxed, and they might obstruct the airways. Otherwise, like as the person ages during the old age, and the male gender, they are more prone to having sleep apnea. But if the patient, we can ask the patient that if they lie on their sides, it sometimes helps some of the patients to reduce the intensity of sleep apnea. So if they are sleeping on their sides in spite of the sleeping on supine position or on abdomen, it might help relieve sleep apnea. So there's another category which is parasomnia, and it has a few subcategories. Like parasomnia, basically it has a broad category of sleep disorders which have abnormal movements, behaviors, emotions, or perceptions during sleep, or just after awakening from it. So one of the most common one is somnambulism. We all know sleepwalking, in which the person moves while sleeping without realizing it. The patient is completely unaware of it, and sometimes apart from walking, the patient might be performing certain more complex actions like running or moving things from one place to another, or passing urine, or even driving. So it is commonly found in children, but family history plays a major role. Like if we have one patient or the attendant comes to us with this complaint, we just need to advise them that do not jolt them from the sleep, because it can lead to fear, confusion, or even state of anger. If possible, we should just slowly and safely guide the patient to the back to the bed. So this is sleepwalking. And next is somniloquy. This is sleep talking. Again, it is common in children. Various like many patients come to us that young children, they complain of the parents complain that their children keep muttering something or the other in like while sleeping. So this is sleep talking. Next is a sleep paralysis. What happens in this condition is the person is unable to move their body, open up their eyes, or speak even if felt awake. The patient might be feeling that they are awake, but they are not able to move their body or even open their eyes. It feels as if someone is pushing them down. It happens because the individual is in sleep, but the brain is active. Risk factors, like why does this might happen? It can be because of prolonged insomnia. It can be because of PTSD, post traumatic stress disorder. It can be because of GAD, generalized anxiety disorder, some panic disorder. It can be genetic, or it can be because of narcolepsy. What is narcolepsy? It is basically the patient might be complaining of sudden attacks of sleep, excessive daytime drowsiness, which is completely uncontrollable. The patient finds it really difficult to stay awake throughout the day, and it might be accompanied with the sleep paralysis, and certain times the patient will be having hallucinations as well. So this is narcolepsy, which is one of the risk factors for sleep paralysis. These were the common sleeping disorders. Okay, so the next one is next we go on to is what is the effect of sleep deprivation. Okay, we are sleep deprived. What effect might it have on us? Basically, see, as we can see, the misconception, people have certain misconceptions. Okay, it's fine, missing few hours of sleep is not nothing at all, and it's just a minor inconvenience, it's fine. But it's not like that. Sleep deprivation really might have certain serious disorders. Like if in early childhood the child is not able to sleep properly, it might affect the brain development and even the socializing skills. So during early childhood, as we saw in that earlier image, that during childhood the sleep duration required was much more than a young adult. So if the teenager is not getting like sufficient rest, the effects are felt in the prefrontal cortex, which can lead to certain uh, risky behaviors. Their cognition is not completely developed, their socializing skills are not developed, so it might lead to certain risky behaviors in teenagers. And if they are like high schoolers who complain, like parents complain that they have less duration of sleep, some 5 to 6 hours even, they were twice as likely to use alcohol, tobacco, or other drugs, who do not, like, as compared to the kids who sleep for 8 hours. Oh, this was basically according to a study done in 2018. So those who sleep for around 7 to 8 hours, and those who are sleeping less than 6 hours, those kids are basically they are more prone to using drugs. So, according to that study, the drug usage was increased in those kids. And for adults also, like we need to have a good night's sleep, because like as we grow older, it's heard that the older adults require less sleep than others, because people over 65, they basically they still need to sleep for 7 to 8 hours, but when they are no longer working, and they are throughout the day they are at home, their schedule is disrupted, so their daily routine is disrupted. So they find it difficult to fall asleep, and we shouldn't consider it as normal, because again it will affect their cognition more adversely than it does in younger adulthood. So if some old age people, they feel like, okay, we are able to sleep completely well, but if they are not sleeping for a minimum of 5 6 hours, then it should be considered an important thing to during our case taking. And apart from that, if someone is not able to sleep properly, and if the next day they are going to their work, there are increased chances of getting injured, or increased cases of having anxiety, depression, and their cognition. As their cognition is affected, it might affect their memory, focus, and concentration on various things. So it basically leads to some form of an amnesia, as they are uh, not able to remember all those things which were usually which we are able to have in their memory if we are having a good night's sleep. Basically, otherwise, lethargy, fatigue, weaker immune system, as we learned during the, like, why do we need to sleep, all those good effects of sleep would be gone, and we might be suffering from all those issues: diabetes, weight gain, increased appetite, weaker immune system, all those things. And specifically, if we talk about diabetes and hypertension, the levels of cortisol, they dip at bedtime and increase over the night to promote alertness in the morning. And again, if we are not sleeping well, then there would be psychological effects of these sleep deprivation. The overlap between the sleep disorders and various psychiatric problems is so great that researchers have long suspected both type of problems may have some common biological roots, like it might be emotional vulnerability or depression, where the suicidal rates are also higher in the cases who are suffering from insomnia, or the patient might be suffering from bipolar disorder, anxiety disorder, or ADHD. So in these cases, we need to consider their sleep schedule, basically, like how good quality sleep they are having, or they are finding it difficult to fall asleep. Okay, so once this is done, how do we what all suggestions do we give to our patients to have a good night's sleep? So what they are basically, the first one is we need to suggest them lifestyle changes. Lifestyle changes may, what all do we suggest our patients? Like caffeine, nicotine, alcohol, they should be completely avoided, specifically before bedtime. It shouldn't be taken just before going to bed. Maintaining a proper regular sleep and wake schedule. Using the bedroom only for sleeping, not for working, not for watching TV, nothing else except for sleeping. And another way to get more sleep is to avoid sleeping in too late on weekends, like on Saturdays and Sundays. Many people might be feeling that, okay, we can have this we can get up quite late, but otherwise one should not do that, because what happens is our circadian rhythm and the body clock, it gets disrupted, and it makes it difficult for those to get up early on the weekdays. It confuses basically the biological clock. And they should avoid naps if possible. If the patient is complaining that already I'm having some sleep issue, they should be advised to avoid naps, so that they can sleep well during the night hours, so they can have a refreshing amount of sleep during the night hours. And if people are having this pets in their house, and they feel awakened by them, or the pet is disturbing or anything like that, try to keep that pet out of the bedroom. Okay. And next changes we can suggest is physical activity. Basically, what happens is regular exercises, it helps people fall asleep faster. It helps them spend more time in deep sleep, and awakens less, uh, as compared to the other time, they awake less during the night. But they shouldn't be suggested never to exercise just before going to the bed, because what happens after exercise, the blood pressure rises, the heart rate increases, and the body temperature also rises. All these things will hinder the quality of sleep. So they might exercise or walk throughout, like anytime during the day, but not just before the bed. And the third thing is sleep hygiene, which is extremely important because it promotes good sleep using behavioral intervention. There are certain things which one should do for their bedroom to have a good sleep. First of all is keeping the bedroom dark, quiet, comfortable, and free from any distraction like our computer, laptops, or television. The background white noise, which is considered for only a fan or air conditioners, that mild noise, that is okay, but otherwise any distraction should not be present in the bedroom. Lights with reddish hue, it might be used if someone wishes to have some amount of light in their bedroom, because that red hue helps melatonin production, so that will again help one have a good sleep. And apart from that, we can advise the patient to have a comfortable mattress, because what happens is the older a mattress gets, it breaks down or it might become uneven, which does not give adequate support to the body and making the patient restless. So we can suggest them to have to check their mattress and have a comfortable one. And apart from that, it happens sometimes that when we are not able to sleep, we have multiple thoughts, we have our mind racing or worrying about something, or like when we are not able to sleep, we might be thinking, oh, I'm not able to sleep, how will I go to work tomorrow, and all those things. Just get out of the bed, sit in a chair, and do all the mind racing there. The bed is only to have a good sleep. Do not do that mind racing there, because so that your brain accustoms to that. Do all the mind racing there. When it is completed, then come back to bed. But during that time, never use the screen, mobile, TV, laptop. Do not use that. Just have your own mind racing, whatever is going on your mind. Just do that, and after that, get back to your bed. Okay. And then again, temperature is one of the things that the body requires. A comfortable temperature, a cooler temperature towards cooler is much better than it is being hotter. So because the body is cool enough, then only it gets ready for sleep. And the cooler temperatures help more of melatonin production. And also, like when we find it difficult to fall asleep, we continuously keep watching the clock, or the alarm clock, or the this mobile we keep checking. So do not do that. Just and never use mobile as the alarm clock, because it will be towards your bedside, and you will be using the mobile to check the time or anything else. That will again disrupt the sleep pattern. So have an alarm clock, but keep it away from the bed, and do not keep checking the time. The next is relaxation techniques. It is I'm a psychologist also, apart from being a homeopath. So what we suggest to the patient is there are certain relaxation techniques which we use during the psychotherapy in certain cases. So for the patients who are complaining of difficult sleep, we can ask them to have perform meditation or yoga asanas, or they can listen to some soothing music which can help our brain and mind to relax. So these can be done. Apart from deep breathing exercises, like focusing on deep breathing can make you feel calm, relax your muscles, and it also helps us lower our heart rate. How can it be done? Like there's no specific position to be done, like the patient needs to sit or lie down in that position or anything like. But the one I prefer for the patients is just lie down on the beds in supine position, have your hands by your side in the upward position, like the palms facing the ceiling. So just have your hands straight besides your body, and then just breathe deeply and slowly, and just have concentration over the breathing. And if the patient they can perform abdominal breathing, that will like add more of the effect on the breathing on the sleep. And the other one is one of the we as psychologists, we use JPMR. It is Jacobson's progressive muscular relaxation. It is a specific technique which is used for the patients who are extremely like they are extremely and chronically suffering from this sleep issues. You might even Google it. It's JPMR. The whole technique will be there, and there's a specific method to perform it. Like we just we concentrate on one particular group of muscles. Like if we are contracting the muscles of the hand, like if we slowly we contract the muscles of the hand, we tense the muscles while inhaling slowly. And when we relax, like when we hold our breath, just uh, just concentrate on the part of the body which is being tensed, and when you release it, then slowly exhale. This is a particular, basically a technique which helps the patient to to contract and relax each and every part of the body, which again helps many of them to have a good night's sleep. So this is one of the techniques. Or otherwise there can be certain oil massages, some essential oils, their fragrance, they also help the patient to have a relaxed mind and body to have a good night's sleep. Next is cognitive behavioral therapy, which means that so first of all, the patient should be taught that do not stress out about not falling asleep. The patient might be having in mind, okay, what will happen? Yesterday also I couldn't sleep. Today also it's the same thing. Just try to we can suggest the patient to focus on the weekly sleep and not on single night, just to have their mind relaxed, and to stop that negative thinking and the expectations and the blame game going on their minds every night. So we can suggest them to focus on weekly sleep, that if it is required, then they might there's certain things done during the CBT, cognitive behavioral theory therapy, but this is the basic thing which we adopt while suggesting the patient. And again is mindfulness therapy. What happens is, during mindfulness, like in meditation, we zone out, we slow down our mind, but mindfulness means we zone in, and we tend to focus on living in the moment. It helps to improve mood, it lessens the anxiety. We just take up the things as they are, we accept everything the way it is right at this moment, so without judging anything. So this also helps many of the patients to have a relaxed mind. Okay, so the next in management is, there are certain foods which help one sleep faster. A general guideline which we can follow is like picking items that have a mix of calcium, tryptophan, vitamin B6, potassium, magnesium. All I have written a few things which are rich in these particular ingredients. These help to have a good sleep, because tryptophan, it's an amino acid that helps make that helps the body make more of serotonin, a relaxing mood hormone, which then helps the body and mind to relax, and in turn the melatonin is also formed. Again, vitamin B6, uh, it also helps in the more production of melatonin. Calcium calcium, how does it help you sleep? Like it helps in the this metabolism of tryptophan and melatonin. Again, similarly, I have written the things that bananas also, they are also high in potassium, and they help us sleep during the throughout the night. Tryptophan, magnesium, all these things are present in banana. The whole grains and white rice, they also encourage insulin production, that again result in the tryptophan activity, and it helps one sleep faster. One thing I guess I have missed here is nuts like walnuts, flax seeds, pumpkin seeds, sunflower seeds. They're all also good serotonin booster, which is again, and they are also rich in tryptophan. Eggs also, they are rich in tryptophan. And white rice, again, it has high glycemic index, and it will naturally induce the increase the blood sugar and insulin levels, which again it helps release tryptophan and helps the person the brain work faster. And again, here honey, it lowers the level of orexin. It's a neurotransmitter in the brain that makes one more alert. So honey, when it lowers down the levels of orexin, our the alertness, the brain alertness is reduced, and one can sleep peacefully. So okay, at the end, I would say that sleep is often not taken too seriously by many people. Sleeping is not a luxury. It's not something that only determines whether you are tired or alert. Sleep is needed so everything in the body and our mind, our brain can work correctly throughout the day. If you can sleep well, then be thankful that you can. Otherwise, everyone is not lucky enough to have a good sleep. So this is it from my side. Thank you so much.
Thank you so much, Dr. Sakshi, for such a wonderful session. And thank you for sharing so many tips, so many important tips. I hope it will be helpful for all to get over their sleep concerns. So, thank you. It was really fantastic. Uh, we will take the questions at the end of the session. Now it's time to welcome our second speaker, Dr. Rajneesh Kumar Sharma, sir, who is our KHA advisor. He needs no introduction as he is a renowned homeopath with over 30 years of experience treating patients from more than 40 countries. He's the managing director of HomeoCure and Research Institute, Spursh Multi-Speciality Hospital, and WebHub Homeopathic Pharma. He's the executive member of Delhi Homeopathic Medical Association, author of several research papers and books, recipient of many national and international awards. He will be speaking on sleep positions and homeopathy. Welcome, Dr. Rajneesh, to
Thank
KHA
you. Thank you.
platform once again. You can start your session, sir.
Okay, thank you. Let me share my.
Yes.
First of all, I would like to thank you, KHA, for giving me this opportunity to express my views on sleep positions and in aspect of homeopathy. As far as sleep is concerned, Dr. Sakshi Gupta has very beautifully and very elaborately delivered her lecture on various aspects of sleep, its physiology, its psychological aspects, and I may cut off my points regarding that. It will save some time. Sleep is nothing but a periodic state of rest which is accompanied by varying degrees of unconsciousness and relative inactivity of body and mind. This is necessary for restoration of health, restoration of our functions, and repair and development of our certain tissues. As far as we live in a regular sleep-wake cycle. The sleep-wake cycle varies in relation to the age as well as gender of the individual. It differs from person to person. Women past age 35, they used to tend sleep more than men. On an average, we can see newborn, they sleep up to 20 hours each day. Children, 10 hours each day. Adults, 6 to 7 hours each day. And elderly, 5 to 6.5 hours per day. There is a great variation of sleep cycle depending on various conditions. There are two stages of sleep. The first being NERM, non rapid eye movement sleep, and another one is REM, rapid eye movement sleep. And REM sleep is a synchronized sleep, and it involves 4 stages. Stage first, EEG activity becomes slower and eye movements become slower as compared to our waking stage. In stage 2, EEG activity is increased with appearance of spikes which are called K complexes. In third stage, the eye movement stop, wave frequency is reduced, and the amplitude of waves is increased in EEG recordings. In stage 4, EEG shows a lot of delta activity there. REM sleep, it is also called dreaming sleep. In rapid eye movement sleep, we used to see various sort of dreams. This phase of sleep is characterized by appearance of dreams, and deprivation of REM sleep may cause a deal of sickness, including anxiety, overeating, hypersexuality. In certain persons, it may lead to a lot of psychological disorder, including schizophrenia also. The effect of sleep deprivation is reversed after the normal sleep-wake cycle is resumed in a period of time. These NREM and REM sleep cycle, they alternate during each phase in night. And each cycle is of 90 to 100 minutes. And REM sleep comprises of 75% of the total sleep cycle, and REM sleep that comprises approximately 25% of the sleep cycle, but it differs from person to person. There are certain physiological changes during sleep, which Dr. Sakshi has explained in very detail, and I will go in short. Secretion of LH that is increased, especially in pubescent boys and girls during sleep. Prolactin secretion is also increased in both men and women, especially immediately after onset of the sleep. Hand waving, swinging of the arms, laughing, and passing of flat tests. These are natural physiological processes which occur during normal sleep. In NREM sleep, this is non-rapid eye movement sleep, there are certain sympathetic changes. In early stages of this sleep, NREM sleep, especially in stage 1 and 2, sympathetic activity decreases. Therefore, heart rate that slows down and blood pressure tends to become slower or decreased. Respiratory rate becomes more regular and it may decrease slightly. In non-rapid eye movement, certain parasympathetic changes are also there. They tend to dominate during the deeper stages of NREM sleep, especially in stage 3 and stage 4. Heart rate, blood pressure, they further continue to decrease, and GI activity, it also decreases with development of stage 3 and stage 4 of NREM sleep. In NREM sleep, there are general autonomic changes. Body temperature tends to fall, and body undergoes physiological changes which are associated with repair and growth of the body. Now, in rapid eye movement sleep, certain sympathetic changes are seen, like sympathetic activity is increased, heart rate, blood pressure, they become more variable and they increase in comparison to NREM sleep. Respiratory rate and heart rate, they become more regular and they may slightly increase as compared to NREM sleep. In non-rapid eye movements, parasympathetic changes are there. Parasympathetic activity is not completely absent during REM sleep, but it tends to be less dominant than in NREM sleep. Some reports, they reveal there is an increase in gastric activity during REM sleep. In NREM sleep, there are some more physiological changes. Brain activity during REM sleep is similar to waking state, and vivid dreaming stage occurs. The body may experience temporary muscle paralysis, which is known as sleep paralysis, to prevent acting out our dreams. If there is no sleep paralysis, we may start moving during sleep. Normal sleep is very essential. You may see a number of persons, they used to snore during sleep. Snoring is a normal phenomenon that may be insignificant clinically, but it may lead to apnea, which can be harmful. The consequences of loss of sleep may include fatigue, loss of concentration, difficulties in coping or job performance. And after 6 to 8 hours of good sleep, they feel very good and perform their best. Sufficient sleep is very necessary. There are several bad effects of insomnia. we have learned in the previous lecture by Dr. Sakshi. Persons deprived of sleep for several days or more become irritable, they feel fatigue, they cannot concentrate, and are usually disoriented. Performance of their mental and physical tasks that deteriorates. Some individuals experience paranoid thoughts like illusions, delusions, hallucinations, and auditory or visual hallucination may lead to a lot of distress or development of some psychological problems like anxiety, GAD, and even schizophrenia. Now we can see different persons, different individuals used to sleep in different positions in their routine life. There are several ways the people used to sleep in routine life. These characteristic sleep positions may reflect their personalities and their inner feelings, even their individual characteristics. Preferred sleep position might hold the key to unlocking aspects of character of the person. Each sleep posture can offer interesting insights into the traits and the tendencies of that individual. We can categorize the sleep position. Let us describe the first sleep position, which is very common. This is the fetal position. The individual lies curled up on side and legs tucked in. You can see in the diagram. This is a very common position. These persons are initially shy, but they warm up very quickly and are sensitive at heart and resilient. This is the common sleeping position, and this is more seen in females. The remedies for such type of sleep position, fetal position, are the most common remedies are baptisia, Baratacar, Mercor, and several other remedies are also there. The next position is log position. This is another very common position. The individual used to lie on side with legs straight and arms side by side. These persons are very sociable. They are easygoing persons. They trust others very easily, and they are possibly gullible but innocent. Being innocent, they trust others very easily. They're like phosphorus, arsenic album, and lycopodium. We can differentiate these remedies with other symptoms also, but the log position is very common in phosphorus, arsenic, and lycopodium. The next position is Yerner position. This is also very common position. The individual uses to lie on side with arms stretched out in front. These patients are not patient. These individuals are open-minded, but they used to be suspicious. They are slow and firm decision maker. They used to make their decisions very slowly, but their decisions are very firm, like lycopodium, ammonium carb, Merxol, sulfur, and several other remedies also. But these four remedies are very common for this type of sleep position. The next position, that is soldier position. The individual sleeps on back with arms straight down. You can see the position. If the individual is standing, it will look like a soldier. These persons are very quiet. They are reserved. They have high standards for oneself and also for others. The remedies for soldier position, they are sulfur, digitalis, abrotenum, and Glycyrrhiza glabra. Glycyrrhiza glabra is a very good remedy for the patients which used to sleep in soldier position. The next position is a free fall position. The individual lies on belly with hands around the pillow. This is also a very common sleep position, especially in females and babies. The individuals using free fall position during sleep, they are very social, they are impatient, secretly nervous, and they are very sensitive to criticism. Although this position is very good for digestion, but these individuals, they dwell for their criticism they faced in past. The remedies for this position, these are pulsatilla, aloes, belladonna, colocynth, nux vomica, arsenic album, populus indicus, ignitia, and platina. You can see ignitia is there, arsenic album is there, colocynth is there, which have bad effects of some sort of criticism. The next position, that is starfish position. The individual used to lie on back with legs stretched out and arms by head. These individuals are very loyal friends. They are not seeking attention, but they are empathetic listener. In this position, snoring is very common. This position may lead to snoring and a very bad night's sleep during due to snoring. The individuals with this starfish position may be restless during nights. The remedies indicated may be pulsatilla, rustox, nux vomica, chamomilla, platina, rhododendron, and viola odorata. We can differentiate these remedies with other symptoms of the individual. Then there is a hybrid condition, soldier starfish condition. Some sleepers resemble soldier or starfish sleepers both, as they sleep on back but do not keep the rigidity of soldier nor the sprawling of starfish. They behave like both soldier and starfish partially. These individuals are very flexible, they are easygoing and easily persuaded by others. This position may lead to snoring at bad night sleep like previous sleep position. The remedies of this type of position are arsenic metallicum, arsenic album, carcinosin, and natrum mars. You can see the starfish soldier hybrid sleepers are often very fastidious. The next position is pillow hugger position, which is common in females and babies. Any position in which the individual uses hugging the pillow during sleep is known as pillow hugger position. Such type of individuals value their relationships. They are people pleaser and they line up with wants and relationship. They value their relations very much, like phosphorus. Another position, snorer position. Any sleep position in which there is snoring. This is known as snorer position. Any sleep position accompanied with snoring is snorer position. The obese patients and certain ENT problems, they may lead to snoring. Such type of individuals are very expressive. They are passionate and they are prone to extreme emotions. The remedies indicated may be anacardium, calcarea phos, china, hyoscyamus, ignatia, acid mure, nux vomica, opium, silesia, stramonium, and some other remedies are also there. But these are the most common remedies I try to describe here. Another one is graphitis also. The next position, that is duvet position. The individual sleeps with one arm or leg sticking out of the duvet. These patients, individuals are very relaxed. They are carefree persons and they are open to various experiences. And these individuals are comfort loving persons. They are comfort seeking persons, like conium, like platinum. Another hybrid condition, hybrid sleep position is prostrate and worship position. This is similar to free faller style, but the hands in this condition are under the pillow. These individuals are very conservative. They desire control and they have difficulty with unexpected events. They are very difficult to face the current problems. like medorinum, calcareous, carcinosin, lycopodium, phosphorus, tuberculinum, and cinna. Now, there is a very typical sleep position, that is king position, which looks like soldier position. The arms are side by side and individual is sleeping straight. But here, there is no vigilance. The individual is not alert. He is sleeping freely. They are very self-confident, open-minded, and creative persons. They always feel happy and easy to control one's manner, like a king. The remedies: sulfur, digitalis, abrotenum, glycyrrhiza glabra. Another sleep position is there, in which the individual sleeps with one ankle locked onto the other. This is known as criminal position. These individuals, they are hindered by inner thoughts, they are anxious, and they reflect their worries by crossing their ankles like rhododendron. Another position is there, that is sleeping lying position. Here, the patient is suffering from insomnia and he is very difficult in falling asleep. The person appears to refuse the sleep. He is struggling with falling asleep. His conscious mind wanting to remain alert, like bryonia, helleborus, lachesis. Here, some physiological or pathological condition of the brain are also there. While these associations between sleep position and personality traits are fascinating, it is very important to note down that individuals' preferences and comfort play a significant role in sleep postures. Some person used to use a number of pillows. Some person avoid pillows. Some person avoid pillow due to some cervical spondylitis or some problems there. And this leads to a change in their characteristic personality sleep position. Each position is associated with specific personality traits and behaviors, providing insights into an individual's character. Their corresponding remedies have been discussed at various places for instant prescriptions. Comfort, health conditions, or even the type of the mattress or pillows and rooms and lights and environment that may affect the sleep position of the individual. Thanks for giving me this time. Sweet dreams.
Thank you so much, sir. It was really unique and very informative session. And Dr. Shravana, do we have any questions in the chat box? Everybody, please write your query if you have any. We will ask the speakers about the same. Please, sir, Dr. Renuka wants you to repeat the circadian rhythm again. Am I audible? Dr. Sakshi, am I audible to you?
Yes, ma'am.
Yeah.
Circadian rhythm, basically what happens is it is stimulated by the light we have. Like the sleep arousal, how it happens, that when that light is blocked, we have these ganglion cells in the retina which are excited by the light. So when the light is obstructed, the signal goes from the ganglion cells to suprachiasmatic nucleus, which is the center of the circadian rhythm. What happens is when that signal is blocked, it the signal, it travels from the spinal cord again to the pineal gland. what happens is the obstructed pathway of the signals. This is the basic signal which is traversed because of the light. When this signal is blocked, when we close our eyes or we have darkness around, so what happens is this signal is blocked, and then the melatonin is produced. When the melatonin is produced, it is basically a sleep inducing hormone. Melatonin is induced, and then we tend to become drowsy. So this is how the circadian rhythm works in the human body. So when it is dark, when it is like during the night time and all, so when that light is blocked, melatonin production starts. It basically starts from the evening, and it peaks in the around midnight, so we are able to sleep well.
Thank you, Dr. Sakshi. There's one more question from Dr. Rekha Sharma. How can we diagnose such cases based on miasmatic analysis? Would you like to answer, Dr. Rajneesh, sir? You're muted.
In each and every condition, firstly, the condition is physiological. SORA is the basic cause which alters the normal physiological reactions, which may be positive reactions or negative reaction, catabolic reaction or anabolic reaction. Both are altered with the effect of SORA. And with continuous and repeated stimulation of SORA, if anabolic reaction is catalyzed frequently, their accumulation of certain material, certain byproducts are accumulated inside the tissues, which may alter the normal physiology, and they convert that into the pathology. If negative catalysis is there and catabolic reactions are altered, stimulated, there may be a shortage of something, and it may lead to the altered physiology in the tissue, and that may also lead to the certain type of pathology. The basic cause is SORA. Now, if accumulation is there, we can assume the psychosis is developed there. And if deficiency starts in some tissues and destruction takes place, the syphilis that may be appreciated. And certain different certain conditions, there may be combination reactions also. SORA, syphilis, psychosis, SORA, and all the three miasms. So these sets of the miasmatic changes, they develop into a particular type of pathological condition, and that may lead to various signs and symptoms, and we can appreciate with the presence of signs and symptoms on.
Thank you, sir. And Dr. Renuka wants to know the reference of these data of sleep position and homeopathic medicines.
Yeah.
If you can share.
Yeah, this data has been collected from various textbooks, and I have not prepared the bibliography here, but I will provide in the next session, or I will provide personally.
Sure. Thank you so much, sir. This is all about the questions. And now we would like to take the privilege to honor you both with the KHA Appreciation Certificate.
Thank you.
Please accept it from KHA Homeopathy Study Group. Dr. Sakshi, this is for you. Congratulations.
Thank you very much.
Thank you, sir. Thank you both for your gracious presence and for your precious time to share your knowledge and wisdom. Now, I would like to announce the upcoming March webinar, that is on 10th March 2024 at 8:30 p.m. IST and 10 a.m. EST, US and Canada. We will have Dr. Nikhil Kambli and Dr. Abhishek Subhash Verkar. They will enlighten us on homeopathic learning through the masters Dr. Boger and on clinical cases, a simplistic approach. You can find the link to register at our website kavitakhomeo.com, and don't miss the webinar. A heartful thanks to our viewers and followers to join us today, and we will have many such informative webinars lined up in the upcoming sessions with many more renowned homeopaths. For the upcoming webinar info or any other updates, you can follow our social media handles on Facebook, LinkedIn, Twitter, and Instagram. If you missed any of the webinar, you can watch it out at our YouTube channel with the name Kavita Kuknur. And I'm thankful to KHA volunteers for their continuous support and selfless services with which we are able to organize these webinars in successful manner. For any other info, reach us at kstudygroup@gmail.com. Thank you everyone for joining us today. And anything else you want to share, Dr. Sakshi, Dr. Rajneesh sir?
I will be sharing the bibliography of this sleep position with you very shortly in
Sure.
WhatsApp.
Sure,
Thank
sir.
you.
Thank you so much. Anything, Dr. Sakshi, would you like to say?
It's just, ma'am, that I'm really honored to be here. Thank you for inviting, and of course, Dr. Kavita ma'am and KHA for having me.
Thank you. Thank you. Shall we end? Okay. Don't miss the jot form. Please fill the form to receive your participation certificate. You will get it within 10 days. Thank you so much for joining. Good night. Goodbye, everyone.